Hello everyone. In this video, we are going to look at the surgery section for CPT coding. So hopefully again you have marked your tabs, and if we open to the surgery section, we first get the surgery guidelines. It goes over the services, the CPT surgical package, follow-up care, materials, separate procedures, unlisted procedures, the special report, imaging guidance, and surgical destruction. Then the next page has all the coding guidelines for the surgery section. Again, please read through these and make sure that you're familiar. Then we have all the unlisted services. If you're coding a procedure that you can't find a specific code, we would assign the unlisted service code. And note that if you have an unlisted code, it tells you that the special report might need to accompany that. Then the next page has the imaging guidance explaining what a special report is and the surgical destruction. And then finally, the surgery section is right there on page 75, the list of the general surgery, and then it starts to break it down by system. So integumentary is the first system covered in surgery, and then you can see musculo, skeletal, respiratory, cardiac, digestive, urinary, on and on. Those are all the different types of surgery, all the way back to radiology. So it ends with the operating microscope and code 69990. And it starts with integumentary and the general, which is 10004. So there's not a lot of procedures just in the specific general surgery, but let's just practice. Let's say that our patient had a fine needle aspiration biopsy of a lesion. So again, to find the codes, you would look in the back in your index. So we're going to go to our index. And we're going to go to B, to biopsy. Or you can also go to find needle. So let's go to find needle. So under find needle, aspiration biopsy, we have five choices, with CT guidance, with fluoroscopy guidance, with MR guidance, with ultrasound guidance, and without guidance. So our scenario didn't say anything about guidance, so we're going to pick the without guidance and look at code 1004 or 10021. So flip back to the tabular, to the general surgery. And find needle is right there, the 10021. We can see that the 10004 is an add-on code for each additional lesion. Since we just did one lesion, we would do the 10021. And let's do one more scenario from this. Let's say that our procedure is an unspecified breast surgery. So where would you find that code? Just pause for a minute and we'll go over what the answer is. Okay, hopefully you're ready to unpause. And remember that the unlisted are always at the beginning. So for an unlisted breast, we would come right here and go down until we found breast, which is right here, unlisted procedure breast. We would assign 19499.